Today we're going to talk about rabbits. Rabbits are an important species. They are raised commercially for meat, skin, and furs. Rabbits are also popular as pets and are used extensively in biomedical research and in consumer product safety testing and toxicology. Rabbits and hares were originally classified as a suborder within the order of Rodentia. Because they possess two pairs of upper incisors, they were eventually reclassified into the order Lagomorpha. There are 80 recognized species of lagomorphs placed in two families containing 13 genera. The family Leporidae contains the genera Oryctolagus and Sylvolagus, which are the rabbits and the hares respectively. The domestic rabbit is the only member of the genus Oryctolagus and is referred to as Oryctolagus cuniculus. Please know the genus and species of the rabbit, again, Oryctolagus cuniculus. There are hundreds of breeds of rabbits, two of which I've put on the slide here are seen in research. The Dutch belted is probably the second most common to the New Zealand white. The New Zealand white was the rabbit you saw on the first slide. The New Zealand reds are also used. They've been used in some ocular related research. The images that are throughout this presentation are from the American Rabbit Breeders Association. I put them in because they have very good pictures of several breeds of rabbits. So I thought that was something that you could look at. It's something that you might be interested in, as you may see some of these unique breeds of rabbits in a clinical setting as a pet rabbit. Adult male rabbits are anywhere from 2 to 5 kilograms. Adult female rabbits or does can be slightly larger, anywhere from 2 to 6 kilograms. The kits, which are the offspring, are anywhere at birth from 30 to 80 grams. Normal physiologic reference ranges. For clinical exam and blood volume, the rectal body temperature of a rabbit is 101.3 to 104 degrees Fahrenheit. The normal heart rate is about 180 to 250 beats per minute. The normal respiratory rate is 30 to 60 breaths per minute. Whole blood volume is 55 to 70 mils per kilogram, and plasma volume is 28 to 51 mils per kilogram. It's important to note that the data listed here are ranges for healthy 2.5 to 3.0 kilogram New Zealand white rabbits. That's the rabbit, again, that I mentioned is most common in research. And lower values can be expected in rabbits that are more acclimated to handling. Normal reference ranges for food and water include daily food consumption, about 50 grams per kilogram of body weight. GI transit time for hard feces is 4 to 5 hours after eating, and the transit time for the cecotropes is 8 to 9 hours after eating. Daily water consumption is 50 to 150 mils per kilogram, and the daily urine excretion is 10 to 35 mils per kilogram. Food consumption is going to be greater in growing, pregnant, and lactating animals. And it's also important to note that the amount of water required is influenced by the food intake, the feed composition, the environmental temperatures. These values are for a normal rabbit fed a standard diet of pellets. The normal physiological reference ranges for reproduction. Age at onset of puberty and breeding life. Sexual maturity for males is 22 to 52 weeks. Sexual maturity of females is at 22 to 52 weeks. Breeding life for males is about 60 to 72 months. Breeding life for females is 24 to 36 months. Normal reference ranges for female reproductive cycle. The onset of puberty varies greatly in different breeds of rabbits. Smaller breeds, such as the Dutch and Polish, develop more rapidly. Does mature earlier than the bucks, and the female New Zealand white rabbits generally mature at approximately 5 months of age, whereas the males reach puberty at 6 to 7 months. Breeding colonies usually consist of 1 buck to 10 to 20 does. The doe is taken to the buck's cage for breeding, as does can be territorial and aggressive, and males can spend a lot of time sniffing around a new cage. It's not uncommon for the bucks to fall off the doe and appear to be fainting after mating. Does do not have a typical estrus cycle, as they are induced ovulators, and show seasonal variation in receptivity. Ovulation occurs at approximately 10 hours after coitus. The length of the gestation period is 29 to 35 days. The doe will often begin nesting or nest building a few hours or days before delivery. The doe plucks fur from her abdomen, sides, and dewlap to line the nest. Ideally, nesting boxes are provided that will allow the doe to keep neonates, referring to them as kits, in a single location. Parturition in rabbits is referred to as kindling, and it usually occurs in the morning hours. The litter sizes is somewhere around 4 to 12 kits. Kits are born blind, hairless, and helpless. The doe will usually exhibit a period of postpartum receptivity. In most breeding programs, they generally don't rebreed the animal until after the kits are weaned. The doe nurses for only a few minutes each day, but the milk is highly enriched, and kits can consume as much as 20% of their own body weight in just a few minutes. Weaning occurs between 5 and 8 weeks of age. The male reference ranges include a mounting time of about 2 seconds. The pre-ejaculatory intermission, there's 1. Ejaculations per mating is 1 to 3. Anatomy and physiology. Rabbits have peg teeth, which are behind or caudal to the upper incisors. These are hypsodontic teeth. They have high crowns, short roots, and continue to erupt during the life to compensate for the wear caused by chewing abrasive foods. These teeth are also in other true herbivores such as guinea pigs, chinchillas, cattle, horses, and elephants. The rabbit has 6 to 8% of its body weight in a skeletal structure versus about 13% in cats. This is due to the need for speed to escape from rabbits as prey. These factors account also for the relatively light weight of a rabbit compared with their size. The females tend to be larger than the males. The limbs are long and the hind limbs longer than the forelimb to make them well adapted for running. There are no foot pads, and the soles of the hind limbs are covered with fur. The toes terminate in long, straight claws. The tail is short and sometimes conspicuously marked. Domestic rabbits have smaller ears and shorter and less powerful legs than hares. And wild rabbits tend to be somewhat smaller than their domestic cousins. Rabbits are well-haired except for the tip of the nose and the scrotum of the males. Their fur is thick and soft and ranges in color from white to dark brown. The image on the left shows a picture of the peg teeth. You can see that second set of incisors behind the first set. They're just caudal. Those peg teeth are just caudal to the incisors. On the right, you're looking at a malocclusion, and you can see that this rabbit has a wad of hair that's become entrapped in the lower incisors. This also shows you what hypsodontic teeth are like and how they need to have a good occlusion so that they wear down normally. and you don't have situations like malocclusion. As mentioned, rabbits have no foot pads. The soles of the hind feet are covered with fur. When they're not housed properly with enough substrate or on the wrong type of caging, rabbits can develop pododermatitis. This is also known as sore hock. There's some images of sore hock on the bottom right of the slide here. The ears of a rabbit are highly vascular and they act as a thermoregulatory organ. Female rabbits have a very prominent skin fold called a dewlap on the underside of their neck. This is an image of a female rabbit with that prominent skin fold called dewlap on the underside of the neck. Both of these images show you the vasculature of the ear of a rabbit. There is a central auricular artery that runs down the center of the ear, and then there are marginal or lateral ear veins. The slide from your book lists figure 9.17 as blood collection from the ear vein. It may be that it's just not very clear, but it looks to me more like they are trying to collect from the auricular artery, because the ear vein is on the lateral aspect of the ear. Thorax and abdomen. The heart is relatively smaller than that of other species of similar size. The respiratory system includes a large right lung divided into 3 lobes. The left lung is much smaller and contains 2 lobes. Rabbit neutrophils have a predominant granule type that stains red and appears similar to eosinophils of other mammals. So this is often referred to as a pseudo-eosinophil or a heterophil. And there's an image of that on the right. The gastrointestinal tract of the rabbit. Like rats and horses, rabbits cannot vomit. The stomach is large and thin-walled and not compartmentalized. The terminal portion of the ileum consists of the sacculus rotundus. This is a round, expanded muscular sac with attached lymphoid tissue. A very large cecum is present in rabbits. The colon is divided into proximal and distal portions and is separated by fussus coli. This structure plays an important role in the production of cecotrophs, also referred to as soft feces. Cecotrophs are composed of water, nitrogen, electrolytes, higher protein levels, less fiber, and higher levels of B vitamins. They are normally ingested directly from the anus in the evening and are also referred to as night feces, although they can be produced at any time during the day. The genitourinary system. Rabbit urine is thick and creamy, and albuminuria or proteinuria is common. Ammonium magnesium phosphate and calcium carbonate crystals are also commonly found. Rabbit urine tends to be highly alkaline, often with a pH greater than 8. Urine color varies from dark brown to yellow. You can see that in the images on the right. And younger rabbits tend to have less opaque urine with no significant crystalluria. Urine consistency varies considerable with diet. The uterus of a rabbit is duplex with 2 cervices and 2 cervical orifices. There is no uterine body. The cervices open directly into the vagina. In males, the scrotum is anterior to the penis. Determination of sex in rabbits can be accomplished by applying gentle digital pressure along the penile opening. Females, or does, have a slit-like opening. Digital pressure exposes the mucosal surface of the vulva. Males, or bucks, have a rounded urethral opening. Digital pressure will extrude the penis from the rounded penile sheath. So here's some images that will help with determining the sex in rabbits. Rabbits as animal models. The Friedman, or pregnancy test, was developed in 1931 by Maurice Friedman and Maxwell Edward Lapham at University of Pennsylvania. It was used to detect human gonadotropin in a woman's urine. The rabbit was injected with the urine, and after a few days, the rabbit was euthanized and dissected to see if the ovaries became enlarged. This was then replaced in 1960s by the husbandry test, which then used frogs. Frogs would lay eggs within 24 hours of the injection if positive for pregnancy. The first home pregnancy test kit was developed by Margaret Crane in 1968 and sold in Canada. By 1976, the FDA approved the home test kits. So this is again a good example of reduction, replacement, and refinement. Rabbit pyrogen testing was developed in the 1940s. This was then replaced in the 1970s by the LAL, or the Limulus amoebocyte lysate test, which specifically detects endotoxins. In 2010, the MAT, which is the monocyte activation test, fully replaced the rabbit pyrogen test. We talked about this also with respect to the 3 R's. Additionally, the domestic rabbit was the first animal model of atherosclerosis. Rabbits have been used in many studies of diet-induced atherosclerosis. Feeding a high cholesterol and high fat diet will cause lesions similar to those seen in human atherosclerosis. In 1973, a Japanese veterinarian, Yoshio Watanabe, was collecting serum from a group of rabbits and discovered that one rabbit consistently had hypercholesterolemia. He started a breeding program to develop this condition in a colony of rabbits. And several of these Watanabe rabbit colonies now exist in the United States. Their ease of handling and large, readily accessible ear veins make the rabbits useful in antibody production and other studies for which large volumes of blood must be collected. Rabbits are also extensively used in eye irritancy evaluations. In most cases, these irritancy evaluations are required by law in the testing of certain consumer products. The test has been greatly refined since its initial development to allow researchers to anesthetize the animal's eyes before performing the evaluation. This has also improved the validity of the test results by removing a significant potential source of pain and distress in the animals. Rabbit breeds. These images come from the American Rabbit Breeders Association. The New Zealand whites are relatively large rabbits. The male adults can weigh 8 to 10 pounds and the female up to 12 pounds. They have muscular bodies, large hind feet, thick fur, and long ears that stand straight up. They're albino. The shorter hairs on their ears allow the pale pink of their skin to kind of show through, and their eyes range in color from light pink to a darker ruby red. The breed was originally developed in the United States and became recognized in 1916. New Zealand's were prized for their quick growth rate and meat production. The New Zealand Reds were initially more popular, and there's an image of the New Zealand Red. I believe it's on the second slide. But the New Zealand White soon overtook that particular breed because of the ease of dyeing a white pelt for the fur market. The maximum weight is about 12 pounds. The Dutch Rabbit was developed in England during the 1830s. Breeders began selecting rabbits that bore the distinct markings that have become the hallmark of the breed known today. The maximum weight is about 5.5 pounds. The Flemish giant was bred as early as the 16th century. It was believed to have originated in Flanders, Belgium. The breed was exported to the Americas in the 1890s to help improve the size of meat rabbits during the Great Rabbit Boom. The docile personality of the Flemish giant has earned it the nickname Gentle Giant. It has varied use basically as a pet, as a show rabbit, for breeding, for meat production, and fur have made it kind of a universal rabbit. There's really no maximum weight for the Flemish giant, but they are often over 20 pounds. So that's going to be the largest rabbit you see on this slide. The origin of the Polish rabbit remains somewhat obscure. The breed was mentioned in English literature in 1860 and was believed to have owed their origins to Britain and not Poland, as the name suggested. Though small in size, the Polish is not a dwarf breed. It has longer ears, a non-brachycephalic head, and less cobbiness of body than the Netherland dwarf. The Polish are a popular show rabbit. Their maximum weight is about 3.5 pounds, so it's a very small rabbit. In the 1920s, the standard chinchilla rabbit became very popular. Breeders recognized immediately that this breed would be of great value for its fur. So almost overnight, the standard chinchilla was the next most popular rabbit next to the Belgian hares. Today, the breed enjoys a more modest but steady exposure. It's still one of the top popular ones with breeders. The maximum weight is 7.5 pounds. Stocks and strains of rabbits. The term stock refers to an animal that has been randomly bred, or more specifically, not inbred. These animals are also referred to as outbred. Outbred stocks of rabbits are available in the New Zealand White, California, and Dutch belted breeds. As with rodents, outbred stocks are usually described according to their source, with a colon separating the source and the stock name. The term strain refers to an animal that has been inbred. A strain is considered inbred when at least 20 generations of brother-sister or parent-offspring mating have occurred. A commonly used strain of rabbits is the Watanabe hyperlipidemic strain that I've mentioned previously. Hybrid animals are the results of a single mating between two different inbred strains. These animals are identified with the name of the originating strain followed by the designation F1. Frequently, rabbits used in biomedical research are designated SPF or specific pathogen free. This is especially common in rabbits that can harbor a number of bacterial and viral agents and can be symptomatic unless subjected to stressful conditions. Researchers must use animals that are free of specific bacterial and viral agents to avoid introducing variables into their studies. Rabbit breeding. The onset of puberty varies greatly in different breeds of rabbits. Smaller breeds, such as the Dutch and Polish, develop more rapidly. Does mature earlier than bucks. The rabbit is used most widely in biomedical research is the New Zealand white rabbit. New Zealand white rabbits mature at approximately 5 months of age, and the New Zealand white males reach puberty about 6 to 7 months of age. Breeding colonies, as mentioned earlier, is usually 1 buck to 10 to 20 does. And does are induced ovulators, like cats, with seasonal variation. Ovulation occurs about 10 hours after coitus. As mentioned earlier, does will begin nest building hours to a few days before delivery. The doe will pluck fur from her abdomen, sides, and her dewlap, and it's best to be providing nesting boxes for does. Parturition, again, is referred to as kindling, and it usually occurs in the morning, and as mentioned, litter size is about 4 to 12 kits. The kits are born blind, hairless, and helpless. As mentioned previously, the doe nurses for only a few minutes each day. The doe's milk is very highly enriched, and the kits can actually consume up to about 20% of their own body weight. Weaning occurs between 5 to 8 weeks of age. Pseudopregnancy is common in does and can result from mounting by other does or stimulation by a nearby male. Pseudopregnancy generally lasts about 15 to 17 days, during which the doe will actually exhibit mammary development and typical nest building behavior. Rabbit behavior. Rabbits make excellent pets and they rarely bite. They can be easily trained to use a litter box. Rabbits housed in groups may develop aggressive tendencies, especially among males. Females will also fight unless raised together from a young age. Feral and wild Auriculatus caniculus are likely to live in groups of roughly a dozen animals of both sexes. Rabbits tend to develop specific dominance hierarchies. During the breeding season, males display distinct territorial characteristics. Rabbits are generally nocturnal, often spending the evening and early morning hours foraging for food. Pet rabbits do not usually exhibit strong nocturnal tendencies. Although not particularly vocal, rabbits may squeal loudly when frightened or injured. They communicate with each other through scent cues and touch, and thump their hind limbs on the ground to warn of danger. Rabbit housing. Solid bottom cages are essential for keeping the feet of rabbits in good health. Daily cleaning is essential to keeping ammonia levels and odors to a minimum. Rabbit urine is very high in crystalline content, so it adheres to the cage and it requires a highly acidic cleaning product. As mentioned, rabbits may be trained to use a litter box. Rabbit litter boxes should contain something like shredded paper bedding. Clay, cat litter, or wood shavings should be avoided for rabbits. Outdoor hutches should be made of non-porous materials to allow for proper disinfection.
Husbandry for rabbits. Environmental enrichment for rabbits can include any of the 5 categories. Common ones include cage toys, hay, and nutritional treats. Rabbits tolerate cool temperatures better than warm temperatures. Indoor housing should be maintained at a temperature range of approximately 62 to 70 degrees Fahrenheit, with a relative humidity around 30 to 70%. Rabbits exposed to excessive temperature fluctuations or temperatures greater than 85 degrees Fahrenheit require additional ventilation and should be closely monitored for signs of heat stress. Ventilation requirements within a laboratory facility are always 10 to 15 room air changes per hour. Nutrition for rabbits. Rabbits are herbivorous and coprophagic. Wild and feral rabbits consume a diverse diet of grasses, leaves, buds, tree bark, and roots. They are notorious for consuming lettuce, cabbage, root vegetables, and grains from gardens and farm fields. Commercial rabbit feed contains approximately 15% protein and 10% fiber. The specific requirements for nutrients vary somewhat with different species and at different life cycle stages. Higher fiber diets are given as needed to prevent the formation of hairballs and minimize the tendency towards obesity. The addition of proteolytic enzymes such as papaya juice may also aid in prevention of hairball formation. One technique to provide this involves soaking a small amount of Timothy hay in pineapple or papaya juice and then feeding the hay to the rabbits several times a week. Rabbits fed ad lib usually become obese. Rabbits can be provided with supplemental foods such as clean, raw carrots and other vegetables. These should not be given more than a few times per week since the nutritional value of these foods is low. Some rabbits will develop diarrhea when overfed supplemental foods. A slow, soft-spoken approach is necessary when handling rabbits. They tend to become easily frightened and will vocalize to try to escape when scared. Rabbits are removed from the cage by grasping the loose skin over the back or the scruff of the neck. The hind limbs must be supported to minimize injury to both the handler and the animal. Rabbits are known to kick with the hind legs and can inflict deep scratch wounds on the handler. In addition, if the hind limbs are not well supported, the rabbit can easily injure its spinal cord. This condition, referred to as posterior paralysis, is a common problem when rabbits are not handled properly. When the animal tries to kick, its heavy hindquarters twist and fracture occurs, usually at the 7th lumbar vertebrae. This condition is not treatable and the animal must be euthanized. To remove a rabbit from its cage or transport it, grasp the animal by the scruff, support the hindquarters with the other hand, and tuck its head in the bend of the elbow. The body of the rabbit should be draped along the forearm. When placing the animal on a table, especially a stainless steel table, it's helpful to place a towel or other covering around or under the rabbit. This will make the rabbit less likely to slip and struggle. When returning a rabbit to its cage, it's best to turn the animal so it is facing outwards before releasing it. This will ensure that the rabbit does not scratch the handler by kicking the handler's arm. Rabbits can be manually restrained for most technical procedures. Some rabbits respond extremely well to relaxation techniques. This involves placing the rabbit on its back in a V trough and gently stroking the animal in a downward direction on its abdomen. Light massage of the masseter muscles is also beneficial. It is helpful to dim the room lights or cover the rabbit's eyes. Many rabbits respond to this type of handling by becoming immobile. The rabbit's respiratory rate becomes significantly lower and the animal appears to be in a state of hypnosis. Nearly all non-invasive procedures can be performed with this restraint method in responsive animals. There's a figure in your textbook, figure 7-4, that shows the proper restraint while transporting a rabbit. Notice that the head is tucked in the crook of the elbow and the dorsum and feet are supported. For more invasive procedures, firmer manual restraint or the use of restraint box is needed. Manual restraint for technical procedures can be performed by wrapping the rabbit snugly in a towel. A hind limb can be removed from the towel for injection and medications. For procedures that require access to the head, the rabbit can be restrained with a handler gently holding the animal up against the body while a second person performs the procedure. Technical procedures that are more invasive or potentially painful, such as blood collection, are usually best performed by placing the animal in a restraint box. There are many types of restraint boxes available. The most common is a polycarbonate container that immobilizes the rabbit while still allowing access to the head and limbs. A cat restraint bag may also be used to restrain rabbits, or a lab coat can be adapted as a restraint device. Identification of rabbits. Cage cards or descriptions of a particular animal's color, patterns can be used for identification purposes. Ear tags, tattoos, and implanted microchips are also used for permanent identification. Rabbits raised by commercial breeders are often supplied with microchips already implanted. Temporary identification can be accomplished with markers or dyes. For permanent identification, the most commonly used method is ear tattooing. The tattoo is applied on the non-vascular space of the ear pinna between the auricular artery and the marginal vein. In show rabbits, the right ear is reserved for registration marks applied by registrars of the American Rabbit Breeders Association. Medication administration. Medications can be administered orally or by subcutaneous, intravenous, intramuscular, or intradermal injection. Intranasal administration can also be useful for some anesthetic agents. Intravenous catheterization and nasogastric intubation are also used for medical treatment of rabbits. Medication doses for rabbits tend to be quite variable and differ by breed, strain, age, and sex. Obtaining an accurate weight before calculating any medication dosage is especially important because body weight estimates are unreliable in this species. In addition, overestimation of body weight is common considering the large volume of material that can be present in the intestinal tract, particularly in the cecum. Injections are routinely given by the subcutaneous route. Intravenous and intramuscular injections are also used. In biomedical research, intradermal injections are used when animals are involved in antibody production protocols. Regardless of the route used, the rabbit must be firmly but gently restrained. It may also be helpful to squeeze the rabbit gently before introducing the needle through the skin to prevent the animal from jumping if startled. Subcutaneous injections are usually given in the loose skin over the back or the scruff of the neck. The rabbit is restrained in a towel or restraint box. Subcutaneous injections can also be administered at the lateral space just cranial to the pelvis. Depending on the site chosen, as much as 100 mL can be administered subcutaneously. Intramuscular injections may be given in the large epaxial or lumbar muscles, the quadriceps, or the thigh muscles. In general, a maximum volume of 1.5 milliliters can be administered intramuscularly. When injecting into the quadriceps or thigh muscles, care must be taken to avoid the sciatic nerve, which is located behind the femur just caudal to the quadriceps muscle group. The marginal ear vein is the preferred site for intravenous injections. A small gauge butterfly type catheter is ideal for this procedure to minimize the possible laceration to the vessel if the animal moves during the procedure. A small amount of topical local anesthetic can be applied to the ear to reduce the sensation of pain to the animal. Intradermal injections can be given in numerous locations, but the most common sites are along the back, just lateral to the spinal cord. The fur should be clipped or plucked from the site, and the site cleaned with alcohol before performing the procedure. The alcohol must be allowed to dry thoroughly before proceeding. The volume given by intradermal injections is usually 0.1 milliliter or less. A small raised bleb, which is known as a wheal, W-H-E-A-L, should be evident at the injection site. If no wheal is evident, it is likely that the injection passed into the subcutaneous space. Medications requiring oral administration can be added to the drinking water. However, some animals may refuse to drink, especially if the medication is unpalatable. A small amount of sugar or syrup can be added to the medication to increase palatability. Solid medications, such as pills or tablets, can be administered by inserting the medication through the diastema into the mouth. Some rabbits will chew and swallow the tablets. Alternately, a solid medication can be crushed and added to a small amount of paste, nutritional supplement, or other palatable substance and added to the animal's food. Oral medications can be administered through a feeding tube or with a stainless steel feeding needle. A small mouth speculum is necessary to keep the animal from chewing on the feeding tube. A syringe case works well for this purpose. Rabbits present a somewhat greater anesthetic risk than other laboratory animals. Rabbits are easily stressed by anesthesia, are difficult to intubate, and have highly variable responses to anesthetic agents. In addition, pre-anesthetic regimes that include atropine are often ineffective because as many as 50% of rabbits have a serum enzyme called atropine esterase that hydrolyzes atropine. Their respiratory center is very sensitive to anesthetics, and their high reserves of body fat complicate barbiturate anesthesia. Because rabbits cannot vomit, pre-anesthetic fasting is not necessary. However, a few hours of fasting before administration of anesthesia aids in obtaining a more accurate weight by allowing some of the intestinal contents to be eliminated. Care must be taken to keep the fasting period to a minimum because rabbits have a high metabolic rate, and prolonged fasting can lead to hypoglycemia and alteration in acid-base balance. Blood samples can be easily collected from the marginal ear vein or central auricular artery. The jugular, cephalic, or saphenous veins can also be used for blood collection. Blood collection by cardiocentesis must be performed under anesthesia and is usually followed by euthanasia because of the high probability of painful complications. All techniques require that the fur over the venipuncture site be shaved or plucked. The site is cleaned with alcohol and the alcohol allowed to dry thoroughly before proceeding. For collections from the vessels of the ear, warm the vessels by holding the ear against your hand or applying a warm, moist cloth. Applications of a small amount of topical local anesthetic will minimize the sensation of pain on venipuncture. A small gauge needle, 25 to 27 gauge, can then be introduced into the vessel. When small volumes are needed, the blood can be collected directly from the hub of the needle. Use of syringes or vacutainer tubes can collapse these vessels, especially in small rabbit breeds. In some breeds, particularly the small breeds, the cephalic vein is not readily visible. In larger breeds, this vessel can be used for blood collection. The saphenous vein is also commonly used. For either vessel, the rabbit should be restrained on its side by a handler who also compresses the vessel. Blood collection from the jugular vein usually requires that the rabbit be sedated or lightly anesthetized. The rabbit is held in dorsal recumbency with its head over the edge of a table and its forelimbs directed caudally under the animal. The neck is then gently tipped back to allow for visualization of the paired jugular veins. Alternately, the rabbit can be restrained with its forelimbs held over the edge of the table. Either technique can be difficult in does with large dewlaps. Rabbits are commonly seen as pets in small animal and exotic animal practices. For many clinical procedures, the techniques are similar to those used for cats. Intravenous catheters can be placed in the jugular, cephalic, or saphenous veins. The ear veins are quite delicate and can be easily damaged by mechanical irritation from a catheter or chemical irritant from the infused substances. These vessels should not be used for catheter placement. Intraosseous infusions can also be used. Other techniques in rabbits include nasogastric tubes. These can be placed in anorectic animals with the same technique that's used for cats. The rabbit should have an Elizabethan collar applied to prevent it from removing the tube. We will now move on to the most common diseases in rabbits. The first disease we'll discuss is pasteurellosis. This is the most common bacterial infection of rabbits. It's caused by an organism, Pasteurella multocida. This is gram-negative coccobacillus. Rabbits may be asymptomatic and harbor this organism in the upper respiratory tract. This can spread to multiple locations and cause a wide variety of disease syndromes. Pasteurellosis. It's an upper respiratory form commonly referred to as snuffles. Clinical signs can include sneezing and the presence of a serous to mucopurulent discharge from the nares. Rabbits often wipe the discharge with their forelimbs, so the feet will show evidence of the discharge. Pasteurellosis can become chronic and may develop into fatal septicemia. Infections may also be evidence such as conjunctivitis, bronchopneumonia, pyometra, and orchitis. Pasteurellosis caused by Pasteurella multocida, as mentioned, can have several clinical signs. You can see nasal discharge, as in the image on the left. You can see torticollis, the head tilt, as the image in the center, or you can see a blocked nasolacrimal duct. But keep in mind, rabbits can also be carriers and asymptomatic. If this is left untreated, it can lead to septicemia. Pasteurellosis is transmitted by direct contact or aerosol contamination. Affected animals must be quarantined or removed from the colony. Antibiotics such as penicillin, chloramphenicol, and enrofloxacin may be helpful, but prolonged use of an antimicrobial in a rabbit can cause a fatal diarrhea. Antibiotic therapy can produce remission, but reinfection is common. Caesarean derivation is required for complete elimination of the Pasteurella multocida from the breeding stock. Immunologic tests are available that use indirect fluorescent antibody or ELISA techniques to identify carrier animals. Please remember that pasteurellosis is the most common disease that we see in rabbits, and it's caused by Pasteurella multocida. In addition to bronchopneumonia that can result from Pasteurella multocida infection, rabbits are susceptible to infections with Bordetella bronchoseptica and carbacillus, which is cilia-associated respiratory bacilli. Pseudomonas, Klebsiella pneumoniae, Staphylococcus, Streptococcus, and pneumococci are also suspected of causing respiratory disease in rabbits. The organisms can be transmitted by direct contact, aerosol, or fomites. Clinically normal rabbits harbor these organisms, and infections are usually asymptomatic except in weanlings and animals under stress. However, these organisms can cause significant mortality rates in guinea pigs and other rodents. For this reason, rabbits should never be housed in close proximity to guinea pigs and other rodents. Enterotoxemia and mucoid enteropathy. The term mucoid enteropathy encompasses a clinical complex primarily of concern in young rabbits, usually 7 to 10 weeks old, although it may occur in adults. Clinical signs vary from constipation with mucus hypersecretion to profuse watery diarrhea. Impaction of the colon from constipation is a common finding. Definitive diagnosis is difficult, but the presence of mucus-covered or gelatinous feces is considered pathognomonic. Infected animals also exhibit hypothermia. The animals appear depressed, with a crouched posture and rough hair coat. The stomach is usually distended with fluids and gas. The duodenum and jejunum are filled with watery bile-stained contents, and petechial hemorrhage is present on the mucosa of the small and large intestines. Mucoid enteropathy. A number of infectious entities can cause this syndrome. The etiology is unknown, but an enterotoxin-induced secretory diarrhea caused by E. coli or Clostridium spiriforme is suspected. Transmission mechanisms are unclear. The causative agents may be part of the normal flora, usually present in small numbers. In addition, antibiotic-induced enterotoxemia can be a factor, especially with administration of lincomycin, clindamycin, or erythromycin. Mucoid enteropathy can occur in combination with Tisser's disease, salmonellosis, or coccidiosis. A relation between mucoid enteropathy and dietary fiber content is suspected. High fiber diets are thought to provide a measure of protection from this syndrome. Treatment is not usually successful, and infected animals often die within a week. Measures to reduce stress must also be addressed. Listeriosis. Listeriosis is characterized by sudden death or abortion and is most often seen in does in late stages of pregnancy. The causative agent is Listeria monocytogenes. The organism spreads by the blood to the liver, the spleen, and gravid uterus. Clinical signs include anorexia, depression, and weight loss. Listeria monocytogenes is a zoonotic disease, and treatment is rarely attempted. Tizer's disease has been reported in nearly all species of laboratory animals and is found throughout the world. The causative agent is the gram-negative, spore-forming, flagellated bacterium Bacillus piliformis, also known as Clostridium piliforme. Definitive diagnosis requires histologic exam of tissues from suspected infected animals. Poor sanitation and overcrowding predispose animals to this disease. Weanling and immunocompromised animals are most severely infected. Clinical signs of Tizer's disease include diarrhea, dehydration, and anorexia. Tetracycline compounds added to drinking water for 4 to 5 days can be used to treat infected animals. Careful attention to proper sanitation and reduction of stress aids in preventing this disease. The organism is difficult to eradicate from an animal facility because of the ongoing presence of resistant spores. Mastitis. Mastitis is not common except in colonies maintained in commercial rabbit breeding facilities. Like many bacterial diseases in laboratory animals, poor sanitation contributes to the incidence and spread of this disease. Mastitis can develop into a generalized septicemia and is usually fatal under those conditions. Staphylococcus is the most commonly isolated causative agent, but other bacterial agents have also been implicated. Infected does have inflamed mammary glands. The initial red swollen appearance of the mammae can progress to cyanosis. The disease is sometimes referred to as blue bag for this reason. The doe is usually anorectic and febrile and may manifest polydipsia. If diagnosis occurs early in the course of the disease, parenteral administration of penicillin can be helpful. Cephalosporins, aminoglycosides, chloramphenicol, and tetracyclines can also be helpful. Care must be taken in treating this condition because antibiotics can lead to diarrhea from microbial imbalance in the gastrointestinal system. During treatment, a high-fiber diet is indicated to minimize the possibility of diarrhea. Kits from infected does should not be fostered to another doe because they will spread the infection to the foster mother. This image shows a rabbit with mastitis. The mammary glands are thickened and indurated. Treponematosis. Treponematosis is also referred to as vent disease or spirochetosis. It's caused by the spirochete Treponema caniculi. It occurs in both does and bucks and is transmitted venereally and transplacentally. The incubation period is 3 to 6 weeks. Infected animals develop lesions of the genital region that initially appear as small ulcers and eventually become covered with thick scabs. Definitive diagnosis is based on clinical signs and observation of the spirochete by dark field microscopy or serologic testing. Infected rabbits are treated with penicillin, given by parenteral injection once a week for 3 weeks. A high-fiber diet and administration of antidiarrheals may be needed to avoid potential complications of antibiotic therapy. If rabbits are maintained in a herd for commercial breeding, all rabbits in the herd must be treated and not bred until the organism is eliminated from the colony. Viral diseases of rabbits. Most viral diseases that can infect rabbits are not routinely found in the United States. Viral diseases of rabbits include the infectious fibromas, papillomatosis, rabbit pox, herpes virus 3 infections, myxomatosis, and infectious rotaviral enteritis. Papillomavirus. Oral papillomavirus and cutaneous papillomavirus. The oral papilloma type is characterized by small grayish nodules located on the floor of the mouth or underneath the tongue. Cutaneous papillomavirus usually only infects cottontails and is characterized by thick wart-like lumps on the neck, shoulders, and ears. Rabbit pox. Laboratory rabbits can become infected with rabbit pox. This disease is highly contagious and has a high mortality rate, but can be prevented by administering a smallpox vaccine. Infected rabbits have fever, skin rash, and lacrimal and nasal discharge. Myxomatosis. This virus is transmitted by insect vectors and direct contact. It causes a high mortality rate in domestic rabbits. Clinical infection normally does not occur in rabbits younger than 2 months of age. Signs of infection begin with conjunctivitis and rapidly progress to pyrexia, anorexia, and lethargy. Death can occur within 2 days, or the disease may progress through several stages before fatality occurs at approximately 2 weeks after initial signs develop. Treatment is not effective, and infected rabbits must be culled from the colony. In some countries, a vaccine is available to prevent infection. Rotavirus infection. Rotavirus type A has been found in clinically normal rabbits, and infections are generally self-limiting. The virus is transmitted by the fecal-oral route, and young rabbits may exhibit a severe watery diarrhea. Anorexia and dehydration are common signs. The mortality rate can be as high as 80% in rabbits younger than 6 months. The disease can be complicated by secondary infection with Clostridium species or E. coli, resulting in a much higher mortality rate. There is no effective treatment, but recovery provides a degree of immunity, although the animals remain seropositive for the virus. Viral hemorrhagic disease. Viral hemorrhagic disease is an acute and highly contagious disease that is widespread in China, Korea, and many European countries. The causative agent is a Lagovirus. Aerosol transmission seems to be the most likely route of infection, but transmission by fomites can also occur. The disease primarily affects adult rabbits, especially gestating and lactating does. Viral hemorrhagic disease can cause acute death without prior clinical signs. When clinical signs are present, dyspnea and tachycardia are common. Seizure-like activity can occur, followed quickly by collapse and death. In areas where the virus is widespread, a vaccine is used to protect rabbits from infection. Strict quarantine of rabbits imported into the United States from European and Asian countries is required. Neoplasia. The most common neoplasia of domestic rabbits is uterine adenocarcinoma. This is a leading cause of death in intact pet female rabbits. Clinical signs include palpable uterine nodules, decreased fertility, and dystocia. Multiple tumors are usually present and grow rapidly. Metastasis, especially to pulmonary tissues, is common. Lymphosarcoma, embryonal nephroma, and bile duct adenoma and carcinoma are also somewhat common in rabbits. They primarily affect juveniles and young adults, and a genetic factor may be involved. Lymphosarcoma usually presents with multiple palpable abdominal masses and enlarged lymph nodes. Hepatomegaly and splenomegaly are also common. Biliary neoplasia rarely presents with clinical signs. Embryonal nephroma is a slow-growing and usually benign cancer. Other neoplasias that have been reported in rabbits include ovarian, testicular, stomach, urinary bladder, and skin cancers. All of these are extremely rare. Moist dermatitis. Moist dermatitis is more commonly referred to as slobbers. The condition is the result of bacterial infection of the skin that is chronically wet because of drooling. For example, from malocclusion. or poor husbandry. A foul-smelling exudative dermatitis is present around the folds of the dewlap. Treatment is aimed at correcting the cause. Topical or systemic antibiotics are usually helpful. Buphthalmia. Buphthalmia is a hereditary condition with an autosomal recessive inheritance pattern with incomplete penetrance. It is common in New Zealand white rabbits. Affected animals have enlarged, protruding eyes, corneal opacities, and ulceration. One or both eyes can be affected, and rupture of the eye is possible. Diagnosis is based on clinical signs, and infected animals are usually euthanized. Other diseases of concern in rabbits. Antibiotics that remove gram-positive flora, where the normal intestinal flora is disturbed, can result in gram-negative overgrowth with consequent septicemia in rabbits. Splay leg. This condition is observed in neonates. It is not clear whether it is an inheritable condition or a congenital malformation. There's an image there on the slide of splay leg in these young rabbits. Other conditions of concern in rabbits include mandibular prognathism, which will cause a malocclusion. This is a genetic condition with an autosomal recessive inheritance pattern. It is common in domestic New Zealand white rabbits. The condition presents as an overgrowth of the mandibular incisors and prohibits the normal wearing of the incisors. Maxillary incisors tend to grow in a curve and may pierce the palate. Mandibular incisors tend to grow outwards. Affected animals are usually unable to eat and may die of starvation. Treatment involves regular clipping of the incisors. This slide just shows some images of dental problems in rabbits. The first two images are malocclusion of the incisors. And you can see with the second image in the center that they're being treated. There's also an image of what's called molar spur. This is where there is kind of a spur on the edge of the molar tooth. This can actually restrict the tongue. It can cause ulcerations like you see in the image, and it can cause tongue entrapment. We see tongue entrapment in some of the rodent species also. So this is one to look out for, especially when you're seeing slavers or an animal that is losing a great deal of weight because it can't eat. It may also be a dental problem in the back of the mouth where the molars are.